Dear Carol, dear fellows, after all the incredible talks and brainstorming sessions, I'm sure your minds are brimming with ideas. Before we dive into my presentation, let's take a moment to reset and recharge. Let's do a quick breathing exercise together with a touch of visualization. This is a technique I often use in my PTSD treatment. We are going to breathe in twice and exhale once. Please close your eyes for a moment. Imagine yourself in a peaceful place, a serene beach, tranquil forest, or whenever you feel most at ease. Feel the warmth of the sun on your skin. Hear the gentle sounds around you. And let yourself relax. Now take a deep breath in and in again and exhale. We will repeat a deep breath in and in again and exhale. Know that in the next 30 minutes, you will join me on a journey exploring my PTSD approach, a protocol designed to bring this kind of calm to those struggling with PTSD. I will share my personal stories and my thought process and results of my PTSD protocol, which has already helped 73 successful cases. My name is Ya. I am practicing in Belgium, mainly use acupuncture, fascia therapy, and FSM. I started FSM on 2023 and found FSM a great tool to target the root cause. It allows me to keep my work pace, means treating 16 up to 22 persons a day, 6 days a week, with better and lasting result. Right after my first FSM core training in 2023 in Phoenix, I treated a patient, a lady who had broken her toes when a door fell on her foot. Even after the fracture healed, she still experienced significant pain, struggled to walk properly, and couldn't put her weight on her foot. Using a combination of fascia therapy, acupuncture, and FSM, I was able to reduce 80% of her pain in 60 minutes. As many of you know, this is achievable by targeting the 13 on different tissues. But then she said something unexpected. I feel so nauseous when you worked on my foot. Really? Why was that? Then I remembered Carol's words from the course. When people undergo chemotherapy, they feel nauseous, but the nausea comes from the middle brain, not the stomach. And the trauma has always two parts, the trauma itself and the shock of it. So I asked her, what happened when your foot was broken? Oh, my husband and I were repairing the door, and for no reason, he released his hand. The door fell on my toes. Then I followed up. How you feel about that? Oh, I still cannot talk to him about that. I'm so angry. Okay. Carol's voice appeared again from my right shoulder. What if trauma is the scar tissue in the limbic system? So I treated her trauma by focusing on the middle brain and the medulla. In just 20 minutes, the remaining 20% of her pain was gone. This experience led me to develop my first PTSD protocol, which is 40, 284, 91, 51, 13, and 89, 94, 2 minutes each. As I began using this protocol to treat PTSD, I made several important observations. Firstly, I noticed that for some PTSD patients, 4094 did not relax the up trapezius, but 97094 did. Secondly, while taking pulse readings during the protocol, I discovered that 985 deep limbic system worked better than 89. Using 985 felt like peeling an onion. Emotions surfaced in layers, making it easier to communicate with patient while using neuro-linguistic program combined with FSM for addressing the trauma. Thirdly, I started to pay closer attention to the axillary nerve and its role in trauma. This led me to explore its connection to emotional feedback and survival mechanism. Dr. Belsel van der Kolk once shared a fascinating story about Mr. Nelson Mandela during his course. He asked Mandela, after 27 years in prison, you completely transformed into a deeply mindful person. What happened in the prison led to that transformation? Mr. Nelson Mandela replied, boxing. At first, this sounds counterintuitive, but let us break it down. In boxing, you stand there, anticipating when someone is going to hit you. You duck to avoid being hit, while in the same time forming an action plan to respond. Over time, your brain becomes wired to perceive threat, protect yourself, and anticipate actions. This process breaks the trauma pattern where one might particularly freeze or act impulsively, and instead foster a sense of control and mindfulness. This story made me reflect. Why do we need emotion? Why do we need to remember them? We have 12 pairs of cranial nerves, and they play a vital role in life. But what axillary nerve do? My hypothesis is that axillary nerve is built for emotional feedback. For example, when someone points a knife at you, you instinctively activate your axillary nerve and shrink your shoulder to feel anger or fear to deal with that threat. The anger helps you to fight. The fear helps you to flight or freeze. PTSD in many ways is like frontal limbic pain or thalamic pain. Due to the loss of connection, the middle brain amplifies emotions constantly. So 1394 works for reconnect. Lastly, the deep limbic system is like an internal map of the world around you. We need to help the PTSD patients to reorganize the perceptual reality and rewire these core perceptions. It is like recoding the brain. So first remove the bad things and then put back good things by using 40, 284, 91, 51, 13, and then 54, 58 on 985. So the protocol became 40, 970, 13, 94, 4 minutes each. This phase takes care of the elementary energy system at the bottom of our brain, the medulla, and focuses on relaxing the up trapezius and reconnecting emotional feedback pathways. 40, 284, 91, 51, 13, 54, 58 on 985, 4 minutes each. This phase targets the deep limbic system, changing the perceptions, reorganize their perceptual reality. I start this presentation with mindfulness because for PTSD patients, the trauma often sits in the primitive, non-cognitive parts of the brain. This part of the brain generates emotion feelings, but the thinking brain has no direct pathway to access or control it. You cannot think your way out of the trauma because your thinking brain cannot reach the emotional brain. Neuroscience identifies the medial prefrontal cortex as the part of the brain responsible for interoception. The part of the brain pays attention to yourself. This is the only part of the brain that can communicate with the amygdala, the emotional center. Mindfulness and body awareness, like meditation or neuro-linguistic program, activate this region, helping us manage emotions and trauma. For people with PTSD, the most terrifying aspect is not the external event, but the internal experience, the trauma that continues to live inside them. Many patients panic when asked to observe their breathing or internal sensations, as it brings them face to face with their trauma. We need to gently and safely guide patients to notice and become aware of their internal world. Interoception is the bridge to healing. It allows patients to observe, understand, and eventually transform their internal experience. That is why neuro-linguistic program is very powerful. Here are two stories. Story of healing from loss and trauma. A lady came to me struggling with depression after her ex-boyfriend passed away from liver cancer. She had been there to say goodbye on the day he passed away. But the memory of his unrecognizable, thin, and sallow face left her traumatized. I ran the PTSD protocol and asked her, when was the last 2 times you met before his passing away? She recalled seeing him at a gas station a few years ago and a shopping mall even earlier. Using neuro-linguistic program, I guided her to visualize. From the last memory in the hospital, to the encounter at gas station, to the meeting at the shopping mall, and eventually to their happy time together in the university. Visualize these 4 images, and I suggested she play a movie with these images like flashback with a silly children's song. After just 1 session, she sent me a message while on the subway back home from the session on the same day. I see my big smile in the mirror today, and when I think about him, I feel at peace. 2 months later, she confirmed that her depression had not returned, and she continued to feel good. Story of overcoming childhood trauma. An 18-year-old young girl came to me with a history of being raped by her pedophilic grandpa in the bathroom when she was 12. Since then, she has struggled with regular panic attacks, dissociation, and intense difficulty with all the doors and bathrooms. I ran the PTSD protocol and used neuro-linguistic program to guide her through visualization. I asked her to visualize the house when the trauma occurred. Together, we changed everything inside and outside the house in her mind. We added a curtain to the bathroom and placed her beloved cat, dog in the house. The treatment was aimed to rewire those core perceptions of the world she formed when the trauma happened, to help her to reorganize the perceptual reality. It is important to let her revisit the past, but not relive there. After just one session, her family sent me an email describing her progress. Dear doctor, thank you so much. She came out of your office happy, relieved, and hopeful. She told me she could imagine the shower and even the face of her grandpa. When you asked her to think about something nice, she said she did imagine her friend and also his cat and the dog she loves. She was excited about what she experienced, and it gave her hope as well. Later at home, she took a shower. She had a long shower and found herself, without knowing, with her back directed to the door. This never happened before because she was always focusing at the door. She now speaks about taking a bath at her friend's home. She also said she would like to go swimming. So swimming must also be related to the same trauma, I guess. Thank you so much. This is amazing for her, feeling hope again. Despite the positive result I see with my PTSD protocol, a big question lingered in my mind. What if it is just my placebo effect? What if the results are only due to acupuncture or neurolinguistic program? What if it is my healing energy? Those doubts persisted until my 48th case. An 18-month-old baby boy named Bruno. Bruno had been traumatized after rough vaccination experience. He refused to be touched by anyone except his mother. The moment he entered a doctor's office, he would scream and cry uncontrollably. When Bruno came to my practice, he was no different, screaming, crying nonstop. I decided to try something unconventional. I left the treatment room, leaving only the FSM machine running the PTSD protocol and his mother in the room. I asked his mother to play some YouTube cartoon video about doctor visit and to play with him as doctor and patient. I just check on them every 5 minutes. By the end of the session, something remarkable happened. I was able to undress Bruno and check his belly without any resistance. His next doctor visit the following week went smoothly, with no sign of trauma or distress. This case was a turning point for me. I was not in the room. I did not use acupuncture, and I did not engage in any talking or direct interaction. The only treatment was the FSM machine running the PTSD protocol. At that moment, I realized it could not be anything but FSM. With this clarity, I finally felt confident enough to write an email to Carol and share my findings. Beyond PTSD, the protocol has been a game changer for addiction and phobias. Here are the story. Overcoming addiction. I received a 39-year-old man with 20 years history alcoholism on the 22nd August 2023. Suffering from anxiety, diabetes, celiac disease, and severe liver dysfunction. Hospitalized twice in ICU over the past 6 months due to liver failure. When I first met him, he was extremely weak and had to lie down during the consultation. His mother shared his medical history and I listened carefully. Afterwards, I just asked him a simple question. What happened 20 years ago? Have you experienced any trauma? His face froze, and he exchanged a glance with his mother. In a trembling voice, he replied, "Yes." In my 20 years of treating addiction, I have observed that almost every case of heavy addiction has an underlying trauma component. Why do people become addicted? Does the man know that alcohol is destroying his liver and his life? Of course he does. So why does he continue doing that? The answer lies in the need of relief. When you are constantly chased by a tiger, trauma, stress, or pain, you seek quick escape, addiction. I began treating him once a week, focusing on addressing the trauma at its root. After just 5 weeks, his blood test result showed a significant improvement. More important, I saw life return to his eyes. He was a different person, hopeful, engaged, and ready to heal. So here you can see the blood result from the 30 August and the 21 September. The gamma GT from 4,154 dropped to 896. The other important indicators back to normal. Here is the story of phobia from my Google review. I came to Dr. Ya with a low back pain. At that point, with my X-ray, the general doctor suggested to make some injections in my back in order to weaken the inflammation. I did not want to do it, and I came to a planned session with Dr. Ya. After analyzing my X-ray, she managed to find the cause of my pain and treat it in one session with acupuncture. It was a miracle. I felt great relief and ability to continue my active sport life again. Later, during our session, Dr. Ya worked as well with FSM, and it had a magical effect on me. Before, I was afraid of dog and also sudden noise. The reaction to dog barking or a doorbell would be exaggerated. My heart would beat fast. I would become anxious and scared. Even I know it, even if logically I would understand that nothing is going on and there is no danger. After just few sessions of FSM and acupuncture together, I'm not scared of dog anymore. Moreover, I started to be happy when I saw a dog approaching and I even can touch it. I'm very grateful to Dr. Yar and for the help, just for the help she provided to me. Through this case and result I have achieved, it is clear that this PTSD protocol has been potential to make a real difference in people's lives. But as with any approach rooted in science and healing, there is always room to grow, to refine, and to adapt. My PTSD protocol is still evolving. Every patient, every story, and every breakthrough teaches me something new, and I'm constantly exploring ways to make it even more effective. Let's talk about emotions and 5 elements. In Chinese traditional medicine, emotions are deeply connected to the 5 elements: wood, fire, earth, metal, and water. These elements are meant to flow harmoniously, not become stuck. A close friend once told me, "I want to upgrade my energy level. I will do everything with love." I replied, "That is wonderful, but how you deal with your anger, sad, fear, or worry? Do you suppress them? Ignore them?" In TCM, each emotion is associated with a special organ and element. We have all experienced the power of using 970 on specific organs, achieving great results based on the TCM chat. But let us look deeper. All emotions are tied to organs and elements, and they're meant to flow, not stagnate. Think about the little children. They can cry intensely one moment and burst into laughter the next. Their emotions flow freely without resistance. Emotion is a life force. When emotions flow, they bring transformation. Just like the cycle of the 5 elements, from water present kidney fear, to wood present liver anger, to fire present heart joy, to earth present spleen worry, to metal present lung sadness, back to water, completing the cycle. The cycle repeats endlessly, reflecting the nature flow of life and energy. When we allowed emotion to flow, we align with this natural rhythm, fostering healing and transformation. So I added 970, 320, 135 on certain organ, which is the weakest according to post-diagnose, 2 minutes each into the protocol. And I start pay attention to prefrontal cortex, which I use 81 on 983. Think about this. Why PTSD patients describe trauma that happened 20 years ago as if they were happening right in front of their eyes? Because the dorsolateral prefrontal cortex is offline. Why PTSD patients can be impulsive, have no sense of consequence? Because the orbitofrontal cortex is not well developed due to the traumatic experience. And now let's talk about basal ganglia. This slide comes from Dr. Bessel van der Kolk's course. The pink circle is your brain. When threat come into your brain, you see it, you hear it, it comes into the thalamus and the lateral nucleus of the amygdala, the smoke detector. You said, oh my God, it is really scary. If at that point you are able to take action and do something, and then you will feel, wow, I was able to take care of the stress. So bad experiences aren't always terrible as long as you can cope with it. If you cannot do that, then the impulses will go to the central nucleus of the amygdala. And this part of the brain tells you that you are hopeless, it is nothing you can do. So what can we do as an FSM practitioner to rewire the brain by activating the basal ganglia, possibly with visualization or neuro-linguistic program? I'm currently exploring using the basal ganglia add to the PTSD protocol to treat multiple personality disorder, to address the underlying trauma and integrate the different personality and help to recreate a new one. As we wrap up today, I want to leave you with 3 key ideas that define the heart of my PTSD protocol: flow, connection, and recoding. Flow. Emotions like energy must flow freely. When we allow them to move, we create space for healing and transformation. You can combine with tapping technique or tension release exercise. In our FSM world, we use 970. Connection. Trauma often disconnects us from our body, our emotion, and even our sense of self. My protocol aims to rebuild these vital connections You can combine with meditation, yoga, neuro-linguistic program. In our FSM world, we use 1381. Recoding. By reorganizing the brain's perceptual reality, we can rewrite the narrative of trauma and create new pathways for resilience and growth. You can combine with family system therapy, hypnosis, EMDR, psychedelic therapy, neuro-linguistic program. And in our FSM world, we target 94, 985, 983, and 988. There are more stories to share. I'm looking forward to discussing them in the future with you. Thank you for joining me on this journey today. I hope you find it insightful. If you have any question, please do not hesitate to email me, ya@acuherb.be. Let's continue to explore, learn, and heal together. Thank you.